Hello everyone, welcome back to my channel. Today, we'll do a rapid review of 100 key reproductive system conditions and definitions. This video is designed for quick revision and memorization of high-yield terms for pharmacy school. Female reproductive system: amenorrhea, absence of menstrual periods. Dysmenorrhea, painful menstruation. Menorrhagia, excessive menstrual bleeding. Oligomenorrhea, infrequent menstrual periods. Polymenorrhea, frequent menstrual periods. Female reproductive system: premenstrual syndrome, PMS, physical and emotional symptoms before periods. Premenstrual dysphoric disorder, PMDD, severe form of PMS. Endometriosis, growth of uterine tissue outside the uterus. Adenomyosis, uterine lining grows into uterine muscle. Uterine fibroids, non-cancerous growths in the uterus. Female reproductive system: polycystic ovary syndrome, PCOS, hormonal disorder with ovarian cysts. Ovarian cyst, fluid-filled sac in an ovary. Ovarian torsion, twisting of the ovary. Primary ovarian insufficiency, early loss of ovarian function. Ovulation disorder, problem releasing an egg. Female reproductive system: infertility, inability to become pregnant. Ectopic pregnancy, pregnancy outside the uterus. Miscarriage, loss of pregnancy before full development. Pelvic inflammatory disease, PID, infection of female reproductive organs. Salpingitis, inflammation of fallopian tubes. Female reproductive system: vaginitis, inflammation of the vagina. Bacterial vaginosis, imbalance of vaginal bacteria. Yeast infection, fungal infection of the vagina. Cervicitis, inflammation of the cervix. Cervical erosion, damage to cervical lining. Female reproductive system: cervical cancer, cancer of the cervix. Ovarian cancer, cancer of the ovaries. Uterine cancer, cancer of the uterus. Endometrial hyperplasia, thickening of uterine lining. Endometritis, inflammation of uterine lining. Female reproductive system: vaginal atrophy, thinning of vaginal walls. Vaginismus, involuntary tightening of vaginal muscles. Uterine prolapse, uterus slips downward. Pelvic floor dysfunction, weak pelvic muscles. Genital warts, viral growths on genital area. Female reproductive system: human papillomavirus, HPV, virus affecting reproductive organs. Herpes simplex infection, female, viral infection causing sores. Trichomoniasis, parasitic vaginal infection. Chlamydia, bacterial reproductive infection. Gonorrhea, bacterial infection of reproductive tract. Female reproductive system: vulvitis, inflammation of external genital area. Bartholin cyst, blocked gland near vaginal opening. Breast mastitis, infection of breast tissue. Fibrocystic breast disease, benign breast condition. Breast cancer, cancer of breast tissue. Female reproductive system: delayed puberty, late development of reproductive organs. Precocious puberty, early reproductive development. Hormonal imbalance, abnormal reproductive hormone levels. Congenital uterine anomaly, birth defect of uterus. Female reproductive disorder, any disease affecting female organs. Male reproductive system: erectile dysfunction, difficulty maintaining erection. Infertility, inability to cause pregnancy. Low sperm count, reduced number of sperm. Azoospermia, absence of sperm. Oligospermia, low sperm concentration. Male reproductive system: varicocele, enlarged veins in the scrotum. Hydrocele, fluid buildup around testicle. Spermatocele, cyst in epididymis. Testicular torsion, twisting of the testicle. Undescended testis, testicle not in scrotum. Male reproductive system: orchitis, inflammation of the testicle. Epididymitis, inflammation of epididymis. Prostatitis, inflammation of prostate gland. Benign prostatic hyperplasia, BPH, enlarged prostate. Prostate cancer, cancer of the prostate. Male reproductive system: testicular cancer, cancer of the testis. Penile cancer, cancer of the penis. Phimosis, tight foreskin. Paraphimosis, trapped retracted foreskin. Hypospadias, abnormal opening of urethra. Male reproductive system: epispadias, urethral opening on upper penis. Urethritis, inflammation of urethra. Genital warts, viral growths on genitals. Herpes simplex infection, viral genital infection. Chlamydia, bacterial reproductive infection. Male reproductive system, gonorrhea, bacterial infection of urethra. Syphilis, bacterial sexually transmitted infection. Mumps or orchitis, testicular inflammation from mumps. Delayed puberty, late sexual development. Precocious puberty, early sexual development. Male reproductive system, hormonal imbalance, abnormal reproductive hormones. Hypogonadism, low testosterone production. Androgen insensitivity syndrome, body unresponsive to male hormones. Klinefelter syndrome, genetic condition affecting testes. Congenital absence of vas deferens, missing sperm duct. Male reproductive system, ejaculatory disorder, difficulty with ejaculation. Retrograde ejaculation, semen flows backward. Painful ejaculation, discomfort during ejaculation. Scrotal swelling, enlargement of scrotum. Testicular trauma, injury to testicles. Male reproductive system, reproductive tract infection, infection of reproductive organs. Congenital reproductive anomaly, birth defect of reproductive system. Functional reproductive disorder, disorder without structural damage. Sex hormone disorder, abnormal estrogen or testosterone. Puberty disorder, abnormal timing of puberty. Male reproductive system inflammation, swelling of reproductive organs. Reproductive system cancer, cancer of reproductive organs. Reproductive system infection, infection affecting reproductive organs. Reproductive system dysfunction, poor function of reproductive organs. Reproductive system disease, any disorder of reproductive organs.